Ever wondered how a simple rash can turn your world upside down? What if you could avoid it entirely? Chickenpox, caused by the varicella zoster virus, has been a common childhood illness for centuries. It spreads easily and can lead to complications, especially in adults and those with weakened immune systems. Historically, chickenpox has affected societies in various ways. Before the advent of vaccines, outbreaks were frequent and could disrupt entire communities. Schools would often close, and children were kept home to prevent the spread. The social and economic impact was significant, highlighting the importance of prevention. In this essay, we will explore how chickenpox spreads, its symptoms, and the historical measures taken to control it. We will delve into the development of the chickenpox vaccine and its effectiveness. Additionally, we will discuss practical hygiene tips to help prevent the spread of chickenpox today. By understanding the history of chickenpox and the measures taken to prevent it, we can better protect ourselves and our communities. So, are you ready to learn how to avoid contracting chickenpox? Chickenpox is a highly contagious disease caused by the varicella zoster virus. It typically presents as a red, itchy rash that turns into fluid-filled blisters. The rash often first appears on the face, chest and back before spreading to the rest of the body. Other symptoms include fever, fatigue and loss of appetite. Knowing how chickenpox spreads is crucial for prevention. The virus is transmitted through direct contact with the rash or through respiratory droplets when an infected person coughs or sneezes. This makes it easy for the virus to spread in household settings, schools and other close contact environments. The incubation period for chickenpox is generally 14 to 16 days, but it can range from 10 to 21 days. This means that a person can be contagious before they even know they are infected, making early detection and isolation important steps in preventing outbreaks. Understanding these basics about chickenpox helps us appreciate the importance of vaccination and hygiene in preventing its spread. With this knowledge, we can take proactive steps to protect ourselves and those around us. Recognizing chickenpox symptoms early can help prevent its spread. Initial symptoms include fever, headache, and tiredness. The hallmark sign is an itchy red rash that forms blisters. Blisters appear on the face, scalp, and trunk. The rash starts as red spots, becomes blisters, then crusts over. Chickenpox is contagious from 1 to 2 days before the rash until all blisters scab. It spreads quickly in schools and daycare centers. Understanding symptoms and transmission helps control the spread. Chickenpox has a long history, with evidence suggesting that it has been affecting humans for centuries. Historical records from ancient civilizations, including the Greeks and Romans, describe illnesses that resemble chickenpox. However, it wasn't until the 18th century that chickenpox was clearly distinguished from other similar diseases like smallpox. In the pre-vaccine era, chickenpox outbreaks were common, and almost everyone contracted the disease at some point in their lives. These outbreaks often led to significant social and economic disruptions. Schools and workplaces were affected as people stayed home to recover and to prevent spreading the virus to others. The impact of chickenpox on society underscored the need for effective preventive measures. Before vaccines, the primary methods of prevention were isolation and quarantine. People with chickenpox were kept away from others until they were no longer contagious, which helped to reduce the spread but was not foolproof. Understanding the historical context of chickenpox helps us appreciate the strides made in medical science to control and prevent the disease. It also highlights the importance of continued vigilance and proactive measures to protect public health. Section 5. The advent of vaccination. The development of the chickenpox vaccine was a milestone in medical history. Before the vaccine, chickenpox was almost a rite of passage for children, with nearly everyone contracting the disease at some point. The vaccine changed that, offering a safe and effective way to prevent chickenpox. The first chickenpox vaccine, Varivax, was licensed in the United States in 1995. It was developed by Japanese scientist Michiaki Takahashi in the early 1970s. Takahashi's work involved attenuating the virus, meaning he weakened it so that it could prompt an immune response without causing the disease. Clinical trials showed that the vaccine was highly effective in preventing chickenpox. It became a standard part of childhood immunization schedules, significantly reducing the incidence of the disease. The introduction of the vaccine not only protected individuals but also contributed to herd immunity, making outbreaks less common. The success of the chickenpox vaccine demonstrates the power of vaccination in controlling infectious diseases. It also underscores the importance of ongoing research and development to improve and expand vaccine coverage for other illnesses. Section 6. The importance of vaccination. Vaccination is the cornerstone of preventing chickenpox. The chickenpox vaccine is safe and effective, providing long-lasting immunity against the virus. It not only protects the individual who receives the vaccine, but also helps to protect the community by reducing the spread of the virus. Children typically receive 2 doses of the chickenpox vaccine, the first at 12 to 15 months old and the second at 4 to 6 years old. This schedule ensures that children develop strong immunity before they are exposed to the virus. Adults who have never had chickenpox or the vaccine should also consider getting vaccinated. The effectiveness of the vaccine is evident in the dramatic decrease in chickenpox cases since its introduction. Before the vaccine, about 4 million cases of chickenpox occurred each year in the United States. Today, that number has dropped by more than 90%. Vaccination also helps prevent severe complications associated with chickenpox, such as pneumonia, encephalitis and bacterial infections of the skin. By getting vaccinated, individuals can protect themselves and contribute to the overall health of their community. Section 7. Hygiene measures in history. Before vaccines, hygiene was crucial in controlling chickenpox. Communities practiced various hygiene measures to curb outbreaks. These included isolating infected individuals and disinfecting homes. Public health campaigns emphasized cleanliness to prevent diseases. Posters advised regular hand washing and thorough home cleaning. These measures helped reduce the spread of chickenpox. Schools isolated students with chickenpox to minimize spread. The emphasis on hygiene reflects its importance in disease prevention. Section 8. Modern hygiene practices. Hygiene is key in preventing the spread of chickenpox. Modern practices build on historical lessons, emphasizing cleanliness. Regular hand washing is one of the most effective ways to prevent transmission. It should be thorough, using soap and water for at least 20 seconds, especially after coughing, sneezing or touching public surfaces. Use hand sanitizer with at least 60% alcohol when soap isn't available. Keeping surfaces clean and disinfected is crucial. Focus on frequently touched items like doorknobs, light switches and phones. Avoid close contact with infected individuals. Combined with vaccination, these practices provide robust defense against chickenpox. Section 9. Avoiding exposure to chickenpox. Avoiding exposure to chickenpox is another critical step in preventing the disease. This involves recognizing early signs of chickenpox and taking appropriate precautions to minimize contact with infected individuals. Awareness and vigilance can significantly reduce the risk of contracting the virus. One of the first steps is to be aware of chickenpox outbreaks in your community. Schools, daycare centers, and local health departments often provide information about current outbreaks. Staying informed allows you to take timely measures to protect yourself and your family. If you or someone in your household develops symptoms of chickenpox, it's important to isolate the infected person immediately. They should stay at home and avoid contact with others until all the blisters have formed scabs. This helps to prevent the spread of the virus to others. Additionally, if you have been exposed to someone with chickenpox, it's important to monitor for symptoms and seek medical advice if necessary. In some cases, a doctor may recommend receiving the chickenpox vaccine within a few days of exposure to help prevent the disease or reduce its severity. Section 10. Conclusion. Embracing preventive measures. By understanding the past, we can protect our future. The history of chickenpox teaches us valuable lessons about the importance of vaccination, hygiene and vigilance in preventing the spread of infectious diseases. Today we have the tools and knowledge to effectively control chickenpox, but it requires a collective effort. Vaccination remains the most effective way to prevent chickenpox. It provides immunity and helps to protect those who are vulnerable, such as infants and individuals with weakened immune systems. Good hygiene practices, such as regular hand washing and disinfecting surfaces, further reduce the risk of transmission. Being aware of chickenpox symptoms and taking steps to avoid exposure are also crucial components of prevention. By isolating infected individuals and staying informed about outbreaks, we can minimize the impact of the virus on our communities. Are you prepared to take the necessary steps to avoid chickenpox? With the right preventive measures, we can protect ourselves and others, ensuring a healthier future for all. Embrace these measures and make a difference in the fight against chickenpox.